Hi, everybody. Welcome today. I'm Krista Harmon. I'm one of the career readiness consultants for the Kent ISD, and I welcome you to our career chat. We have Kate Piccard. She is a clinical supervisor in the Spectrum Health System, and we're so glad you're here today, Kate. Thank you for being here.
Thank you so much for having me.
So as we get started today's career chat, I wanted to take you back to high school age. And what were you thinking about back then? Is this what you thought you'd be? Kind of give us that career path.
I'm definitely not where I thought I would be. In high school at 16 or 17, I was an average B student. And I had no specific plans except for I wanted to go into business. That's where I went. I graduated in 97. So in 97, from what I hear now, there wasn't that career planning that helped that I think a lot of the schools have now. And so, almost embarrassingly so, I feel like kids of my generation that graduated, we were going off of assumptions of either relatives, careers that relatives had. We didn't have that access. There was the internet. I'm not that old, but there wasn't the internet. There just wasn't the resources to dive deep. I remember taking there was a test you would take, and everyone was so excited because you would take this test, and it was 80 some questions or whatever, and it would tell you what you were meant to be, and people would walk out of this room with things like forest ranger. Like it wasn't super it wasn't super detailed, and it gave us a lot of false hopes maybe. So I thought I wanted to go into business. I was 16, 17. I graduated when I was 17, so I was a little bit earlier than other people. I had a really serious boyfriend. I thought, this is the road I need to go down. I was raised by a single mom who worked 60, 70 hours a week. She was a waitress, and I knew I didn't want to do that. I had to go to college. I applied for college myself. I actually applied to 2 colleges. I thought I was going to go to Grand Valley, and I went through the whole thing. I applied for financial aid, and I did all the math, and I even went to orientation. And a week later, I sat down with the numbers, and I thought, wow, I'm going to leave, my freshman year with a lot of debt, or I'm going to have to work full time and go to college. So I made a last minute decision to actually go to the community college, where I started classes for my associate's degree, just in general business classes. So even then, I was kind of ping-ponging around with the ideas. I didn't have the guidance, that I feel like a lot of kids have these days, which is really great. So I always say it's just never too late. You can even go to your first class and still change your mind, because I've done that too. So when I was that young, I wanted to go into business, and I went to Grand Rapids Community College, and in the meantime, I was working. I moved out. I was living on my own, and I got a really good job in retail. I got a really good job in retail, and I moved up fairly quickly. So I moved into leadership, and I did one of those things where I can continue after my associates, and I can continue towards something, a degree, but right now I'm making really good money. I'm making good money. I'm making what I need to pay my rent and drive a good car and do that thing. And I'm in retail. So I love people. I've always loved people. Retail was great for me. Kind of went through that, and then I had a few life changes, personal things happen, and that type of thing, where retail just wasn't doing it for me anymore. So I actually got a job at Farmers Insurance for a small amount of time, and then I thought, okay, I'm set for life. This is where I'm going to be. Farmers Insurance, really great job, really great benefits, really great career opportunities, and then I got laid off. They deleted my department that I was in. So, not to give you too much whiplash, but what I did from there is I went to hair school. So at 22, I graduated with my a cosmetology degree, and I did hair for 10 years. And in that time, fast forward, I got married, I had a kid. My husband is a farmer. He's self-employed. We have a lot of personal debt from the farm that we have. And, so he doesn't have that 9 to 5. We don't have that insurance. We don't have, when you're self-employed, you need to consider a lot of the things that you don't get when you're corporately employed. So I decided I love people. I love helping people. I've always thought about going into nursing. I didn't have the resources to go into nursing, and I found one late night searching on the internet, I found the medical assistant program through Grand Rapids Community College. It was a 6-month program, full time. And at the end of that program, you received your certificate. So no college credits in that. However, at the end, you received your, I'm a registered medical assistant. You received that certificate. And that's what I did. I externed at the end of my 6 months for 140 hours with the office that I'm at now, currently. It's a primary care office, family medicine, pediatrics. So that's where I externed. I got my feet wet, and I love being an MA. I love being in primary care. In primary care, we see beginning to end of life. Those are our patients. We follow their journeys. We follow their families. We see their siblings. We see their cousins. We see their sisters. We're part of the family. People rely heavily on us, and they give us a lot of trust. Those are things that I take pride in and that drive me in my personal career. Being an MA itself, just the clinical knowledge that we have. When you think about back in like the 1980s, doctors' offices used to have nurses that did our jobs. And so the transition has happened to where we found that a medical assistant can do in the office and work in a scope of practice. We work below a scope of practice as of an RN, but we can still work within the scope of practice and do what we need to do for patients. So medical assistants, those are the people that when you come and see your doctor, they room you. They take your vitals, they ask you how you are. We go through medications. We do point of care testing. So if you've ever had your throat swabbed for a strep throat, we do. We check blood sugars. We do urinalysis. We do one of my favorites for some odd reason, ear lavage. That's when we clean out your ears. So a lot of hands-on, very technical things. So you have to be detailed oriented. You have to have time management skills. And one of the things that I tell all of the candidates who apply for MA positions in my office is I tell them, you need to have initiative. You have to have initiative. I don't care if you are a brand new MA off of the street or 10-year veteran. You have to have the initiative to see a problem before it develops and get ahead of that. Not only to save time, to keep people on schedule, but to keep people safe and to do the right thing for patients. So I became an MA. I loved it. And I worked for providers. I worked for physician assistants. I ran what we call our clinic visits, which I did people who need to come in and they don't need to see a doctor. So if you need a blood pressure check or a testosterone injection, or you need your hepatitis B booster, whatever, I ran that. That was mine. I took personal pride in it. And I got to know our patients. To this day, when I walk in our waiting room and people recognize me, and I love being able to say hello and ask how they've been. So I've always most jobs that I've been in, I've gone to a leadership position in those roles fairly quickly. Clearly, it's just some. Oh,
No, this has been amazing. But I want to, before we get to your leadership part, because I think that's so important, I
yeah,
want to just pull out a few really great things that you've shared, just so the students, I guess I want to just shine some light on some things. So when you
sure.
talked about way back at the very beginning, that you just had assumptions about what was out there, kind of what through what relatives did or what you saw on TV. That's still very much true, unfortunately, for today. And yes, we have a lot more career development, but I want young people to know that if you don't have that support, that this is something that hopefully through these activities you can get some more data and research and continue to search just like she did. But I love too that you took that self-initiative to apply for college, but you also made a decision for yourself about the cost, and that you made the decision to go to community college. That has been something that's kind of been running through some of our talks, and it's giving kids an idea that there's choices and that there's not just one way. And so I just love that too. I love also that you were able to get your certification. That first of all, you did 10 years of something else. And young people, it seems like the world, you have to have it all figured out. And I love that even up to the age of 22, you had a variety of jobs, you were paying your bills, you were being independent, and that you did hair for 10 years and you still made another choice. And so I just want young people to know that this is so fluid in our journeys, and just never, when adults say, what are you going to be when you grow up? You know, you can tell them what you're exploring, but you do not have to have that whole answer. So before we get to your management position, I'd love to dig in just a little further into the actual training for an MA or RMA, a registered medical assistant. You mentioned it was a 6-month program, which I think is very exciting for some young people, because college debt is real and they don't have to necessarily go to 4-year to still do a lot of the hands-on activities with patients. And a lot of our students love the idea of pediatrics. So I think that's exciting, I would assume, for them to know that you can do pediatrics without being a full-fledged nurse. So tell us what that 6-month training was like. And
Sure.
about the externship too. Is that something the school set up for you? So give us a little more detail about that.
Sure. There's a couple ways you can become a medical assistant. So you can become a certified medical assistant through programs like the one I went through. And I'll touch very briefly, because I didn't go through it, but I will touch briefly on there is associate programs for medical assistants. A very close friend of mine, her name is Anne. You guys didn't need to know that, but now you do. And she went to Davenport. She got her associates to be a medical assistant. She worked here full time until she went to nursing school. She worked here part time, put herself through nursing school. She's been an RN for 2 years, and now she's going back to school to become a nurse practitioner. So her journey made sense for her, because getting that associates in for medical assisting, she got those college credits, which transferred over, and then she was able to use towards nursing. So a couple of different ways you can go about this. Me, where I was at in my journey, I needed something that was financially feasible for my family and the timeline. So the 6-month program, this was back in 2013. Do you care if I share the price? Like,
No, that's
okay.
great. Let people know.
If I remember correctly, I think it was around $6,000 for the 6-month program. And, I sat down with my husband and we talked about it, and, we need to make it happen. And we did. So the 6-month program, Grand Rapids Community College has a great program. Maybe I'm biased, but they have a very, very tight curriculum, and they have very, very high standards, which I really, really appreciated about this class. So high to the fact that they split the program into 2 sections. That first section, not a lot of clinical work, a lot of reading and just anatomy and pharmacology, those types of things. I mean, definitely a high overview of that, staying within the MA scope. But at that halfway mark, if you did not hold a certain percentage, and it was high, around, I feel like it was 85 to 90%, you weren't okayed to go on to the next part of the program. They had extremely high standards. So once we went through that first part of the program and got to the second part where we started learning the clinical, that, that's when it got a little scary, it got a little real. I never in my life, the biggest thing, never in my life thought I could poke someone with a needle. Never in my life thought I could poke someone for a venipuncture and draw blood. It was scary. It was horrifying, but I had a great classmates. I had great teachers. You learn about the skill until you can do it, and you trust yourself, and your teachers won't let you do anything. I've seen people say, yeah, you're not ready yet. So that, it was that first kind of learning part, and then the clinical, very high expectations. They set us up with interviews. We had interviews with Metro and Spectrum at that time. Sorry, Mercy, it was St. Mary's. And they offered externships. A really just funny side story of how I even ended up here. They got my address wrong. I live on a street that is northwest, and they thought it was northeast. So my address northeast was almost right next door to the office that we started at. They put me at the office. I said I didn't want to go there. I wanted to go closer to home. And the teacher said, no, you'll love it here. And I rolled my eyes, and here I am, working at the office almost 7 years later. So I was able to extern. You shadow another MA very closely. We let you take your wings when you're ready, and we are confident that you will be safe with our patients, and you do the job.
That's fantastic. And I think for young people, they wonder like that transition of the education to actual work. And so it's good for them to hear that there's someone that's showing you around, they're training you on site, that you just don't get your certification and here you are, you get to start, that there's someone kind of hand holding you through that process. And I think that's important for them to hear. So again, I want to point out that you mentioned that there's the two routes. There's the associate's degree, which you'll be earning college credits that you can then build on to that next level of education if you want your career path to go, or the 6 month, which again is a finite amount of time that you get your certification and you can start to work. So helpful to hear for young people to know there's options depending on what their own family situation is. Mm-hmm. So you gave a great description about what the typical day is like, and how much you were invested in your patients, and that you got to actually run certain procedures like as if you were a nurse. There were certain things. One of the students wants to know what maybe you don't like about your job.
Well, I guess we would, is the question what I didn't like about being an MA or what my current job is? I'm a clinical supervisor now. So I worked my way up as an MA for my first 2 years. I became a care team lead, which is an MA that we have on the floor that is just a know-all, be-all. You are putting out the fires. You are there to help that staff. You are just, my care team leads are amazing people. And I was a care team lead for about a year. We went through a large change in the office here where we integrated 2 very large offices to make the largest primary care office in Spectrum Health. So we needed to hire a new supervisor. As a care team lead with this big change that we were going through, I was invited to sit in on some of the supervisor interviews to make sure that we were finding a good fit. And I went through a couple of these interviews and I couldn't help. I went home every day going, I can do this. I can do this better. I don't have that person's bachelor's degree. I don't have that person's experience, but I know what the answers to these questions need to be. I know what my office needs. And I asked if I would be considered for the position. They allowed me to interview and I received the position. I didn't have, the accolades that the other candidates had, but I knew what needed to be done here. And I knew what someone needed for us to succeed. And that's how I got my current job.
I think it's also because you have an amazing spirit and care for patients. And I think you probably have an infectious way about you at the office too. And so I can see why you were, and like you said, you've kind of gone up the ranks at each of your jobs because you have such a warm way about you. And customer service like personified and just your personality. So I love it. And so that's how you got it. So if a person was coming off the streets, would they have to have a degree? Is the fact that you worked there, worked your way up, the reason you got that, or do most of them have degrees? So you're more the exception than the rule.
I wouldn't say that I'm a rare exception. However, I think that the biggest thing that I would love for anyone to get out of this conversation is that I'm a firm believer in it's our experiences and what we make from it, and whether it's a hard lesson learned and you learn from that and you grow, or a great experience and you don't take that for granted and you learn from that. That's what builds your equity. That's what builds your personal equity. I'm a hiring supervisor for our office now, and I've just always been a people person. And when I sit in an interview, my interviews are longer than most, and they're probably a little less conventional than most. But I honestly feel interviews need to go two ways. I need to make sure that they're going to be a good fit here, but I need to make sure we're going to be a good fit, because that work-life balance and feeling a part of something, that's what is important. Happy people make safe environments for patients. So
maybe I'll have you give one of your inside interview tips here in just a minute. We only have about 7 minutes left, but
sure.
I'm not sure we finished, is some of the things you don't like about your job has to do with the management now?
Yeah, I would definitely say, as far as the clinical supervisor portion is, number one, I don't have as much patient interaction. However, I have to remind myself consistently that the actions that I take and the things that I do every day are on behalf of our patients, and that's how I serve them. And that kind of relates to the second thing that I struggle with is almost every decision that I make is two-sided: business need and people or patient need. There's money. We have to make money to be able to serve our patients. And sometimes that feels, I personally, it's just the person that I am, that feels ugly to me. But then that other half of me that knows we have to make money to make things work, to be able to provide the programs that we do. So it's that two-sided coin. I am not a black and white person. There is so much gray in my world, and that's a good thing for me.
Yeah, absolutely. Absolutely. I just put out in the chat to see if the students have any other final questions, but I think you've done such a great job, Kate, explaining what our RMA is, ways to get into it, things that you love about it. I guess because this hasn't come up yet in any of our career chats, what are some of those things, just a couple sentences that make an interview go well? What kind of inside tip would you want these young people to have when they're starting to apply for these jobs?
Most interviews will start with, why are you applying here? Why are you interested? And I need to hear something from you. I need to hear something that resonates with me. I'm not, this is what I've done and this is what I'm used to, isn't a compelling reason for me to hire you into it, because I need to hear your drive, your passion for wanting to be here before we go next step, because I recognize that those are the employees that stay here that make it this place a great place to work, and will continue to stay here.
I think that's a fantastic inside tip, that you have to show that passion. Like, you're not just having a job to have a job, that you want to do patient care. And there's certainly some enthusiasm from these young people already. When I read some of their reflections after these career chats, they certainly have a heart for people already and want to serve and help. So young people, just make sure you're sharing that, just like Kate was saying at the beginning of your interviews. Any special patient story that you'd like to share as far as really what drives you in this work? I know you probably have a lot of special patients, but anything that kind of stood out that you'd like, just as a fun story for young people to hear? Good or bad, really?
Right. Um, oh, I think that just an overall thing, being a part of this office, when I came to this office, I had a 6-year-old daughter, and I got pregnant with my son. And so being pregnant, um, through that whole pregnancy with this huge family that we have, of just the staff that we have, but like our patients were so sweet. They would, bake me banana bread, and they just, as I followed them through their lives and making sure, Barb, are you taking your pill in the morning now, because you were taking it at night, and I need to make sure, she was coming in and saying, you need to put your feet up at night, like just that belonging, and just the fact that we serve our community and we keep them healthy, and that means so much to me. But when we put that behind there, we mean that much to them. So
Absolutely.
that's very
And,
touching.
and I just want to point out again the type of department you're in, because again, you mentioned pediatric. So is it family medicine? Is that what you said?
We have family medicine and then internal medicine and pediatric physicians in our office.
Okay, because I want young
So
people to understand that as we look at these specialties, that if you're looking at working with kids, it's that family medicine type part of Spectrum Health or Mercy Health that you're going to want to aspire to.
mhm.
It doesn't always have to be just at the Children's Hospital, for example. I guess I wanted to point that out.
No, there's a lot of different medical assistants. I'll go to spectrumhealth.com. Just look at their jobs right now. We are going through an MA shortage right now. We have done so much within the organization within the past month. We have upped the pay rate for MAs. We are now extremely competitive for this area. We've recognized that medical assistants are a trade. They are a valued trade, and we need to pay them and treat them as such, because they keep our offices going. So medical assisting,
Yeah,
many fields.
go ahead and give that amount, because I don't think that even the information they're going to see on the internet is keeping up with the pay that's been going up locally, because there's such a shortage, you guys. I don't know if you realize, but there's a terrible shortage of MAs. So if you're thinking that you want to get in the health field, this is a great way to go. And there's actually an apprenticeship through Michigan Works. They have an apprenticeship that you can have the job while you learn, and so you have zero debt, zero amount you have to pay. So that's Michigan Works. I'll send that out. I'll look that up. Maybe Jerry can do a quick search of the West Michigan Works medical apprenticeship, MA apprenticeship. And if you can find that, Jerry, throw that in the chat. But what is the pay rate going right now?
We're starting MAs at about 16 an hour.
Yeah. Yep, because it was 14 even just a year ago, right? So it's already bumped up to $2 an hour. So that's great, Kate. I'm going to show them, thank you, Jerry, a few resources. As I do that, Kate, I'd like you to kind of think of your final word of wisdom. The kids have already said in the chat that you explain everything so well. They love how you're sharing about the different jobs you had. It's been very, very, very helpful to them already. But I'm going to share a couple of resources, and then I'll come back to you for that final word of wisdom, and then we'll finish up hopefully right on time here. So again, the title for you guys is a registered medical assistant. That's what the title of this career is. And so again, I want to encourage you to go to get more facts about this type of job at onetonline.org. And if you're new to career chats, this is a resource that you get some of the nuts and bolts of these different careers, how much money they make, and if it's a growing field, typical tasks. And that's why I took a screenshot of the ONET, and I looked up in this particular, they call it a medical and health service manager. And what I love is that they also have the different titles that this can fall under. So again, it's going to help expand your knowledge of what different occupations are. So that's just really important. And it talks about work styles, work values, and then gives you some ideas of related occupations. So again, it's going to help expand your knowledge, because young people tell me, I don't know what's all out there. How am I supposed to choose? Just like you were saying, Kate, in the beginning, you didn't know. And so these tools can help young people figure this stuff out. Kate, I believe you said yes to this. I meant to ask, is it okay if they follow up with questions if anyone has a specific question with you?
I'd be happy to.
That's great. And so that is Kate's, I think I asked it in the initial, when you first said you'd do it, but I meant to confirm. So Kate Piccard at spectrumhealth.org. So feel free to ask a question if you have anything that we didn't get to today, but you did a great job, Kate. We definitely covered a lot. And again, my name is Krista Harmon at kentisd.org. So I'll just let that sit there for a second. So what do you think is a final word of wisdom, Kate, as we finish up here?
Just that I really advocate for everyone to allow yourselves the ability to evolve as a person, evolve as a human being, evolve in your career, e- as the type of person you want to be. Your path can absolutely look one way in one year and a different in another year or a different decade, and that's okay. I currently did apply and I was accepted for the Futures program, which was the free college that was put together by the governor due to the COVID pandemic. And so I'm going back to school this winter, and
Good for
I'm
you.
extremely excited. And the connections that I've made here at Spectrum Health, we offer mentorships, there's career advice, there's resume help. We have a great organization. I'm going to take advantage of every tool that they give me. That's the other thing. Recognize your tools, and don't be afraid to ask questions and reach out. People, whether you know them or not, are much more willing to help and answer questions than you would think. So you'll never know until you know. I almost sunk 10 grand into, my first year at Grand Valley, and I would have if I wouldn't have asked questions. And not that that would have been a bad thing. There are different paths for different people.
But just know
But
your options. You just want
yeah,
young people to know there's options.
you have to be willing to advocate for yourself. Yeah.
Absolutely. Such great advice. Great way to end it. Kate, you've been a gem. Thank you so much for joining us today. The
Thanks for
kids are
having
very
me.
excited. Lots of thank yous in the chat. You just have a great afternoon. And I'll get
Thanks, you
back
guys.
to you soon. Thank you, everybody.
Take care.